Again, thank you everyone for being with us today for our Workforce Recruitment and Retention webinar. Very exciting and ongoing challenging topic, and we're hoping that we can bring some success stories to the table today to really help you build capacity in your state flex programs. So we have got a packed agenda today. Certainly would love to hear from you all upon conclusion of this. If we can save your Q&A toward the end, that would be fantastic. We got some great speakers. I think you're going to be really, really happy with today's presentation. So with that being said, those of you maybe first timers in the group, my name is Nick McCrae. I'm one of the program specialists here with the National Rural Health Resource Center. I serve as a administrative technical assistance function for the Flex Grant, and the center focuses on these 5 core areas to support rural health systems. So we take a lot of pride in being able to help you all with that. And our organization is firmly committed to diversity, equity, inclusion, and anti-racism. We also strive to support not only the flex programs, but all of the critical access hospitals build that capacity as well. So please check out some great resources on our website we have for you to support your journey in DEI too. Today's webinar objective is the conclusion. We hope that you're able to apply the knowledge that you gained in this to improve your state flex programs workforce efforts across the state. We want you to be able to actually gain knowledge in this. Is obviously recruitment and retention is an ongoing challenge, and being able to relay that to the cause. We want you to be able to walk away with some knowledge gained from this. We would like you to be able to recall these best practices and apply them to support cause and their technical assistance needs, and relate these best practices to integrate within improving your programmatic evaluation of your flex program activities. So that's our intent for today. We do have some exceptional speakers with us. We got really a packed agenda here. We're going to start with our federal partners updates. NOSOR is with us today, so they can attest to any of the SOAR funding associated as well. Then we've got 3RNet, all things rural recruitment, and they're just a wealth of knowledge are with us today. We have some really exceptional examples of workforce recruitment and retention best practice from Oklahoma Flex and Montana Flex with Fairview Regional Medical Center and Clark Fork Valley Hospital. Very excited to hear from some of our best practice award recipients. And then we'll close out today with polling and Q&A. And thank you all so much for being with us. And with that being said, we could start off with, I see Megan's in the audience here. Megan, would you like to kick us off with updates from FMT?
Sure, no problem. Thanks, Nick. So we have just a couple of updates from Flex Monitoring team. One, we are really excited about the National Critical Access Hospital Quality Inventory and Assessment that launches tomorrow. You'll be receiving an email from FORHP tomorrow morning with a live link to the assessment to share with your hospitals and a bit more information. And then we have a kickoff webinar tomorrow afternoon at 3 o'clock Eastern, and hope to see a lot of you there. A few other things, we've had a couple new products released by the FMT on our website in the past couple months. Just yesterday, we released a new policy brief on the provision of hospice services by critical access hospitals, and that's on our website. And then a little while back, we released a final evaluation report from the previous EMS supplemental grant funding, and that's also on our website. In the next week or so, the annual MBQIP reports will be finalized. There's both state reports and a national report. Those state reports and spreadsheets will be shared on the NIH workspace, similar to how you receive your other MBQIP reports, and the national report and state reports will also be available on the FMT website. And so keep your eye out for that. And then we've been updating our MBQIP quarterly reports as well. If you're not receiving those or are not sure how to access those, please reach out to your FORHP project officer. I'm also happy to help if you have questions. And finally, we're wrapping up several projects from our last project year, looking at things like electronic health record use in critical access hospitals and emergency preparedness planning, as well as non-operating revenue and costs. So some products to look out for in the coming couple of months. And then we're also working on some projects getting into a bit more on workforce. So really applicable to the exciting things we can hear about today, as well as CA-based EMS services, frontier CAs, and supporting CA-owned RHCs. So lots going on with the FMT. We're always around. If you have questions, please feel free to reach out, check out our products or the Compass website, or anything related to the MVQIP reports. So happy to answer any questions. Otherwise, I'll turn it back over to you, Nick.
Thank you so much, Megan. And yes, lots of exciting things here on the agenda as we wrap up 2023. And let's see, we've got several of the Telegen, our Arquita team with us today. Anne, would you like to attest to what all you have to share?
Sure. Yes. Thanks, Nick. Just some updates here from Arquita. We launched the monthly newsletter this month with an introductory newsletter. And so monthly newsletters are going to be available to share resources, address common questions we're seeing. And the common questions we're also seeing just through the technical assistance that we're directly giving CAUS and state flex coordinators. The newsletters will also have upcoming reporting deadlines and any other MVQIP updates. We will also share Arquita events, partner events, or MVQIP relevant events, and educational offerings that would be helpful to you and the cause out there. The newsletter will be geared for you, but will be worded in a way that can go directly out to the cause. So they'll be shared with you so that you can disseminate them out to your facilities. We heard that the data submission deadlines and encounter period table was really helpful. So we've been working on that, and that will be coming out in the newsletter so that you can share that with your hospitals too. Starting next month, we will start sharing information about the new MVQIP measures in the newsletters. And we're also working on resources to help cause and you in navigating those new measures. We've had a couple of state flex coordinators reach out to us because they wanted presentations to their hospitals on those new measures. And we have a few of those upcoming here in November and December. So if you have a request for a presentation on the new measures, please feel free to reach out to us at our email, arquita@telegen.com. Thanks, Nick.
Thank you, Anne. And we're very excited as Telegen gets entrenched and gets our communication lines going. And so please, they're also always open and receptive to any of you that have questions. And let's go ahead and start developing that exceptional communication with Telegen now as they're rolling all this excellent correspondence out. So thank you so much, Anne. Let's see, we got Laura. Would you like to speak to FORHP for us?
I sure would. Do you have the slides that I sent over to you so I can show folks some dates that are coming up? Our flex update right now, these are mostly our important due dates that we have coming up. I know it's reporting season and I know everybody's overwhelmed. We have a lot going on right now. We are here to help you. TASC is here to help you. So is Telegen, so is FMT. Let us know how we can support you. Coming up next week, your PIMS reports are all due in EHB on October 31st. And your end of year reports, and for those of you who had an EMS supplement this year, your reports will be due on November 30th, and those are also in submissions in EHB. This is the change that we had talked about, and I had sent out an email on a couple months ago. Your FFRs are now due on November 29th, and that means that carryover requests are due 30 days after that, so December 29th of 2023. This is a hard deadline. I do not have the capability of giving any kind of an extension request on a carryover. So if you have thoughts and ideas right now on things that you might want to do with your carryover funding, please reach out to your project officer now so we can start having those conversations. We can help you get your documents in a row and tell you what kind of language needs to happen. Just reach out early if you can. Next slide, super quick. And this is just a reminder. I know everybody knows this because it's already in the back of your mind. Your NOFO is coming soon. Tentatively right now, the competitive NOFO will be out in grants.gov in mid-December of 2023. It will be due back 90 days after it drops. So you have 90 days to write it. And that'll be mid-March of 2024. The EMS supplement is also going to have a NOFO. It will be coming out very quickly around the same time. I think maybe a week's difference, but we don't have set dates yet. So stay tuned. Everything's a bit tentative. Those are going to come out around the same time. So just plan for that for the first few months of the year as to write your NOFO. My one piece of advice is to make sure, because I know mid-March, a lot of times that's spring break, especially if you have kids, please make sure that more than one person has a login for grants.gov. So that way, if you are out on vacation or someone else is, there's a backup available to submit that when it is due. From what I've been told, if you ask for an extension request on this, they'll give you like a day and that's it. So please make sure when we give you that due date, you have that in your mind in big red letters all over your calendar with a backup option to push submit. And a lot of people ask about carryover when the time comes. So you will have the opportunity to do a carryover as normal because you are not switching grant numbers. You're not closing one and starting a new one. This is continuing your current grant. So if you do have unspent funding from this year, you will be able to carry it over next year. And my other updates are actually just a couple of quick thank yous. The first thank you, as I'm going to say, is I'm very excited for this webinar. This has been a labor of love between me and Sarah DeYoung-Wee, who is our program coordinator on the SOAR program, along with Chris Salyers from NoSOAR and Caleb and the TASC folks, because we know that workforce is a huge, huge concern. So we wanted to bring a way to bring all of our resources together. So we're going to say a big thank you to Sarah and to Chris for all of your information and all of your help and guidance in this. And then the other piece of information I have, the other thank you to give, is to one Miss Catherine Miller, because she has been with the Flex program for about 15 years now, I think, unless I have that date wrong. And she is leaving us in a couple of weeks to go to a new position at the University of Wisconsin. So everybody give Catherine a big thank you for mentoring other Flex coordinators, participating in workshops and all of our reverse site visits previously, helping us with evaluation and think through program stuff. So Catherine, thank you very much. We wouldn't be able to continue Flex without you. And that's the end of my updates. So is it a TASC update next?
It is, and we've thank you so much for that, Laura. There's certainly the we want to take full advantage of that carryover funding. That's certainly not to be undercut, nor is the efforts on behalf of both Sarah and Chris, and of course Caitlin too. That's we can't tell how much we appreciate them and their efforts to put this together and commitment toward the Flex program. So that being said, our TASC updates, we've got a several of which you all have mentioned. We do have the population health toolkit, and the HCAP vendor updates are pending. We've got several exciting VKGs that are rolling out here in very near future. So please, the calendar holds, do what you can to attend those, because we intend for those to be of very high value to you all as well. Definitely just want to foot stomp taking full advantage of the evaluation series that we're actually the 5-part series that Megan spoke to earlier. I think that can't be understated. And then of course we this quality inventory kickoff call. Anytime it comes to data collection and you can anticipate some resistance from the cause on that, but the reality is that's going to set them up for future success as we transition to value-based care. So please have them participate and learn from this tomorrow's afternoon, this inventory kickoff call, and as we continue with the quality inventory assessment. So we also have these state Flex profiles are up to date, and with that being said, we've got some exciting speakers today. The two health systems that are really that we're highlighting here, both Clark Valley Hospital and Fairview Regional Medical Center, were both recipients of the Best Practice Recognition Awards, and we'll have a write-up soon published on both the website as well as Rural Route. Please take a look at that for more details about what they're going to test to today. And also, please keep in mind, if you have any rock stars within your state that you'd like to highlight for the next nomination, be considering that as well next time that's up. So with that being said, I want to just thank you all so much. I didn't know if Laura, before we get to 3RNet kickoff, is there anything else in terms of NOSOR that you all wanted to share? I know
Nope,
it's kind
just
of a collaborative.
Major thank you to Chris for all of your help and information in planning all this, and we can send it right over to Mike Shimmons.
Fantastic. Mike, yes, sir. There he is, the man. The
Hey
myth, the
there, how are
legend.
you?
Hey, doing great, sir. How are you?
Good, good. Thank you very much.
Would you like to run your slides, sir, or you and your team, or would you like me to pull them up here for you?
I guess I thought you were going to pull them up, Caleb, if you don't mind.
Sure, here we go.
Yeah,
Let's
you're
do
gonna
that.
you'll have to advance them then too, correct?
Yes, sir. Can you see
Okay.
that?
Yep, I sure can.
Excellent.
Okay.
Take it away, Mike. Thanks, sir.
All right, really appreciate it. Thanks for this wonderful opportunity. We have had many conversations like this over the years, including even this summer with Laura and several others, and really appreciate the opportunity to kind of talk about 3RNet today and actually a couple of workforce educational tools that we have, especially one that we want to get to later. I want to welcome also my two colleagues here, Mark Barkley and Mandy Gingeris. They will be also covering part of this presentation with me. So I'm going to just cover the first part and I turn it over to Mark, and then Mark will turn it over to Mandy, and you'll hear a lot about just different resources that 3RNet has, and particularly the resource we call Recruitment for Retention Readiness Assessment. So let's go ahead to the next slide then, Caleb. Sorry, Caleb. I knew I was going to do that, Nick. I'm sorry.
Mike. No worries.
Okay. So many of you know 3RNet, or maybe you've heard of 3RNet, but maybe you don't know exactly what we do. So just briefly, this tagline is what we came up with about 2 years ago when we did some rebranding. The nation's most trusted resource for health professionals seeking careers in rural and underserved communities. We've been doing this since 1995. Members in each state, organizational members in each state, are the backbone of this operation. Many of you work for those organizations, whether it's a state office of rural health, a PCO. In a few states, we have PCAs as our lead agency, or maybe a nonprofit organization, but we do have representation in all 50 states. We also have 4 non-state members of 3RNet, including 2 federal partners, the VA and IHS. The Northern Mariana Islands is probably one of our unique members, Commonwealth of the US, and then Cherokee Nation in Oklahoma, as a sovereign nation, also has membership in 3RNet. So we've been running this organization for so many years, and over the years I've learned a lot of different ways and techniques and tips on workforce that we want to talk to you a little bit about today. So when we say we're teaching recruitment for retention best practices for nearly 30 years, that's where that comes from. A lot of historical and a lot of great people that have done this work over the years that we've learned from and kind of compiled information from. So let's go ahead and go to the next slide, Nick. All right, so again, a couple of years ago, I mentioned we totally redid our website, and we also did a total rebranding campaign. So if you haven't seen the 3RNet logo, it looks like this, and this is why. And the last part, I think, is the most important. Most people, we find it very subliminal, but in there is heart. That's the type of health professionals we're trying to find in the country, are those that want to work for places that are safety net, including critical access hospitals, but also other safety net facilities. So we're nationwide. We're in the job search business primarily. We're in healthcare, and we are looking for clinicians and other health professionals that have heart. So let's go ahead and go to the next slide. So this is a really kind of quick slide, but it does say a lot about who 3RNet is, the services that we provide. The job board. Most people know the job board, have seen it, or know that we're in that business. The 3rnet.org. If you have not been to our website, please take a look at that. You will find every state, again, posting jobs on there. That local organizational member or state organizational member is the one who makes the approvals for that. And they work with all the facilities in their states to access 3RNet according to rules that they set. So every state's a little bit different. A lot of them have free and open access. A few of them work with fee-based stuff. There's a lot of different models for that. Obviously, in your state, you'll need to know what you're doing if you're already not running the 3RNet in your state. And also, since we're talking critical access hospitals here, I don't know if there would be any reason why critical access hospitals should not be posting jobs on 3RNet. So hopefully, all of your CAs are already doing that. If not, please continue to promote it to them, and we would greatly appreciate. So the job board is kind of the foundation, going way back to the beginning of 3RNet of our work. The educational component has grown vastly over the year. There's a few things listed here, and of course, one that we're going to dive into a little bit more deeply. One, though, is the Academy. The Academy is going on right now. That's a 6-part webinar series. Many of your states participate in the Academy as what we call a state sponsor, where they pay one fee and then they can invite as many healthcare facilities to participate as possible. Every year we have a little different take on the Academy, but we are covering recruitment for retention, best practices and resources. This is our 8th year doing that. So we're currently just already finished our 2nd of 6 for this fall. We'll go through December on that. That's a tool or a resource that we really want you to be thinking about. And again, we appreciate those of you that have participated, those states that have. This year, I know it's between 20 and 25 states that participate in that almost annually in the Academy. Community APGAR, I won't touch too much on that, but that's a program that Mark Barkley has been very involved with in his past, and also with 3RNet. Recruiting for retention guides. This is probably one of the best access resources we can have. Again, I'm going to have Mark probably touch on that here in a little bit. But that grew out of a lot of educational work that was done in the early 2000s and has been updated repeatedly over the 20 years. Very great resource, 4 separate guides, excuse me, on how to do recruitment for retention. And it's a great resource that you want to offer to your facilities. So those are something we've done. I hope that you're familiar with that. The recruiting for retention assessments, obviously, we're going to be talking about that in more detail. PRISM is a new program that we picked up. We've been involved with it since its inception in 2010, and that is really a surveying tool of National Health Service Corps and other loan repayment programs that we were able to partner with and actually take on a few years ago. So Jackie Fennell of our staff is the primary contact for that, and a lot of data has been generated out of that over the years. Dr. Don Pathman at the Shep Center in the University of North Carolina is our researcher on this. We started, when we took over the program, there was 21 states participating. There are now 35. So we have grown it a lot, and we've been very excited about where we're going with PRISM. If you haven't come across PRISM in your own state, please reach out to us. And even if you have, if you have questions, let us know. And then lastly, we started a new product earlier this year, and this was really an extension of the website and the job board. For those facilities that are posting on our site already, if they want to have an additional set of tools, we have a product now called 3RNet Plus Tools. It is a fee-based program, but it gives them extra tools that they can use in their work in recruiting for retention. So we're very excited about that. But it is a newer program for us. We're just getting it off the ground this year and marketing it. So those are some of the resources that we have. All of those are available to critical access hospitals through your work, and we appreciate any support in those. Go ahead in the next one, Caleb. Okay, so just some quick growth. Again, as I mentioned to you, just 2 years ago, we had only 3,300 jobs posted and about 405 employers posting those jobs. We changed a lot on our website, and then of course, post-COVID hit, and look at where we are today. Over 11,000 jobs posted on our site. Which isn't necessarily a great thing. It means there's a lot of need, but it does mean that we're reaching more facilities to get those jobs posted. So we are excited about that. 1,400 different employers are posting active jobs. So that's a lot of growth in 2 years. And like I said, we're excited to be able to offer that. I hope that you're inviting your cause to the table to participate. And if there's any questions at all, just get back to us and we can certainly tell you more. Go ahead, Caleb, next one. All right, and then we've had a couple partnerships that are really exciting in the last 2 years as well, actually just in the last year. One is with with NARC, National Association of Rural Health Clinics. Their job board now on their site, and there's a link here, uses 3RNet job postings to power it. So any rural health clinic or critical access health hospital job that's posted on 3RNet is automatically fed into their site and can be organized just like 3RNet. So if you go to the site, you'll see it powered by 3RNet on their site at National Association of Rural Health Clinics, which we're very excited about. Also, the other partnership we were excited about, and it works the same way with NARC, is NAO, the National AHEC organization. With these AHEC scholars they have, and again, many of you may be familiar with this, these are health professionals that spend some additional time getting extra training through the AHEC program. When they finish their AHEC Scholars program, they can now purchase or get a badge that can carry with them, like on LinkedIn or other social media sites, that it tells people that they've finished and completed this extra training. And with that extra badge, they can now use that on 3RNet as well. They can include that badge on a 3RNet profile, and any employer that's looking at that can click on that and find out a little bit more about AHEC scholars and what it took for them to earn that credential. So we're very excited about these partnerships. The same thing with NARC also on this. They have a badge that you can earn, or actually a credential that you can apply for and earn. Many of you may have that. That also can be used on 3RNet. That's something that we've worked out with them as well. So we're very excited about these partnerships, very excited about the opportunity to grow 3RNet, and again, give you kind of a highlight of some of the different educational programs that we do. And again, I'm going kind of fast through here, so I want to leave plenty of time for Mark and Mandy. Go ahead to the next slide, Caleb. Okay, so this is the point. I'm going to hand this over to Mark Barkley. Mark has, and I'm going to give you a little bit of brief background. Both myself and Mark and Mandy all have served as state representatives of 3RNet, or what we call network coordinators. Myself in Missouri for 6 years, Mark did it several years in North Dakota, and Mandy was several years also with the bi-state PCA in New Hampshire and Vermont. So we come to this all from a statewide view of workforce, and interacting with many of the programs we're talking about here between Flex and PCAs, PCOs, all this kind of work we're very familiar with. And Mark particularly had a lot of unique experiences there in North Dakota. So I'm going to let him take it from here and explain kind of our readiness assessments that will be available for questions and after. So Mark, go ahead and jump in.
Yeah, thanks, Mike. So welcome everybody, and thanks again for having us. So what we're going to really try to cover today is some of the resources and really lessons learned that we have found through the different educational processes that we've been involved here with 3RNet. Obviously with the goal of you being able to take some of that information back and share it with your cause, so that hopefully some of the things that we've learned they can implement and kind of replicate in their own communities. So one of the things that we're going to kind of focus on, this is a formal kind of assessment process that we've done here at 3RNet with different critical access hospitals, rural health clinics, FQHCs. It's been funded by different organizations, but what we're going to kind of do is outline how we typically do the process with these individual healthcare entities, again, with the goal being that you understand the process a little bit and can hopefully kind of help some of your critical access hospitals self-identify some of the lessons that we've learned here. So for these recruitment for retention readiness assessments, really the goal is to give them kind of an outside perspective of their organization and their community, so that that critical access hospital, that rural health clinic, whatever the case may be, can kind of hopefully see themselves a little bit through the lens of a potential healthcare professional. So we start with a really informal interview process. And one of the key things, I think, with all of these educational resources that we're going to be talking about, and by the way, I did add a couple of links in there. So all of the guides that Mike spoke to, all of the resources that we talked about are available to you to share with your critical access hospitals and others with that link in the chat box. But what we're really trying to do is help them kind of, we all hear those really great stories within rural and underserved healthcare organizations of those things that really make those communities and those organizations special. All of those folks, whether, whatever type of agency they're working for, they're choosing to work for that organization for a reason. So what we're trying to do is kind of tap into all of that goodwill, those what we call unique selling points, and hopefully provide some guidance to be able to better recruit and retain. I think we can go to the next slide, Nick. So again, what we're trying to do is give them an unbiased review. And we all know, especially in the virtual world that we live in, that maybe 15, 20 years ago, somebody's kind of first initial impression of a community was when they did a site visit, they're walking down Main Street. Now a lot of that stuff is happening online. And especially in rural and underserved areas, we need to kind of always fight that perception that we're isolated, maybe we're not currently up to date with technology, different things like that. So one of the things that we do is we start with an unbiased review of their web presence and job postings, social media, those sorts of things. And we'll talk about some of the best practices related to those findings here in a minute. Then we also want to identify what they're doing uniquely well. Mike alluded to earlier, I used to recruit for our 36 critical access hospitals here in North Dakota. And at that time, all 36 of those hospitals were basically using 3 main points to recruit. They were saying, hey, come to our CAW because we offer loan repayment, we have pretty good salaries, and we have great hunting and fishing. So those 3 things are great, but if all 36 of those critical access hospitals are marketing the same 3 things to kind of the same candidate pool, right? Nobody is really setting themselves apart in a unique way. So we want to kind of go beyond some of that surface information and through storytelling and through testimonials, find some of those unique selling points for a community. And then obviously no community is perfect. So we want to identify barriers and then ultimately connect them back to folks like you guys, right? Because we all know that all of those critical access hospitals out there need assistance. They need to be connected to folks like state offices of rural health and PCO offices and their flex and ship coordinators. So we try to identify those folks within the report so that they can connect with you all to learn about the resources that you provide. So ultimately, we go through that process with them and we provide them a summary report. And again, that's what we're going to try to go through today, is give you some insights of what we found so you can pass those along to your hospitals. So I think we can go to the next slide, Nick. So we start off with a kind of an executive summary. So I'm not going to go through line by line certainly here, but as we all know, stable and supportive administration is key. You know, one of the, I think, largest factors that we see with folks that are struggling with workforce is constant turnover. And a lot of times that's something related to leadership. So having strong leadership and being able to communicate that to potential health professionals is really important. Also, a lot of the healthcare professionals that we're trying to attract really are mission-minded folks. They want to serve in rural and underserved areas so they can make a difference, so they can have a full scope of practice, they can take care of patients that they care about. So really, you know, what we kind of phrase all of that in the term of culture, right? You hear a lot about culture in the workforce environment, but what we really try to do is empower those healthcare organizations to promote their culture, to say, come here because, you know, the patient's not just a number to you, you know, come here because you can have that full scope of practice, you can have a family life, you can work in an environment where your employees, you know, feel good about what they're doing and they'll help you out. So that family kind of culture is really something that we think sets communities apart in a real prominent way, rural communities in a real prominent way. But the trouble is it's really difficult to market culture. So that's what we're going to spend the next few slides on, is how healthcare organizations can kind of use some different tools to market that culture. Next slide. So again, we start with some of their web presence. So as you're working with your hospitals, you know, have you looked at their website? Have you went through it not only from a patient's perspective, but also a potential health professional's perspective? We hear a lot of stories about technology barriers, right? I was in a hospital not too long ago where a potential health professional indicated if they weren't able to submit their application entirely online, they just would not worry about it. They would just move on to the next organization. So these are real barriers that some of the folks that we're working with having job postings on their websites, having you know, not just an HR kind of job description, but also really focusing on selling and marketing their community. So a lot of times we're thinking about these digital media as kind of patient tools or to attract patients, but also whether we intend them to or not, healthcare professionals that are looking to, you know, join our practice are going to be finding these things. So it's really important for us to communicate that to the folks that we're working with, that they have to consider all of their virtual presence as kind of a workforce tool as well. Next slide. Also, just knowing what's out there, what other people are saying about you. I use this example, but I think it really holds true. I mean, if any one of us are doing virtual online shopping, you know, whether it's on Amazon or Target.com or something, I would think a high percentage of us are looking at reviews of a product before we actually purchase that product. So that same premise holds true for potential candidates. So knowing what's being said about you, say on Google reviews or Indeed, Glassdoor, Facebook, just kind of generally knowing what's out there. Is there confusion? Are there old outdated links? Are there things that aren't relevant anymore? And then also utilizing social media. You know, one of my favorite things to look at when I'm looking at a critical access hospital website, for example, is when they highlight existing employees. You know, maybe it's an employee of the month or, you know, some cool community event that they're doing, but those real life things that are happening in the communities, those things that can show our culture. Those, from my experience, and I think the experience of us here at all of 3RNet, those instances of culture are really what draws people in to our rural and underserved areas. Next slide. Then also just looking at, I talked a little bit earlier about their career page. So a lot of times we're seeing, folks posting like an HR typical job description, right? So an HR job description is saying, okay, I'm a critical access hospital. Here's what I need from you as a potential candidate, right? We want to kind of flip that around to say, here's what we can provide to you. Here's what we provide to our employees. Here's how they feel valued. Here's what we're doing to not only get you here, but to keep you here and to keep you happy, keep your family and all of the decision makers within your life kind of happy. So we really want to encourage healthcare organizations to take a very candidate-centric approach when they're communicating, and really focus on not only what we need you to do for our organization, but here's how we're going to support you as well. Next slide. So then finally, I had alluded to this earlier, but we want to help them also identify unique selling points. So in that last link that I provided, academy.3rnet.org/TASC, that is where you can find all of these resources. We have identified and piggybacked on the research that was done with the Community APGAR program that identified 50 factors to kind of answer the fundamental question of, going back to my North Dakota example earlier, if we have 36 critical access hospitals in a state, why are some better at recruiting than others? Why are some critical access hospitals in this instance better at recruiting than others? So they were able to identify through research 50 factors that influence people's decisions to work in a critical access hospital. And that is one of those resources that's at that link. So you can provide those resources to the organizations you're working with to hopefully help them kind of self-identify, again, not only what they're doing well, but what they're doing uniquely well, and then also targeting people and demographics of providers or employees that find those things that they're doing uniquely well desirable, right? A really clear example here is you might have great schools within your rural community, but if you're marketing to somebody that's maybe 10 years pre-retirement, they might not have school-age children. So again, we want to encourage them to think strategically, to use those resources to highlight all of their unique selling points, and not just kind of those standard ones like, hunting and fishing, et cetera, that we see a lot in rural and underserved areas. Next slide. So obviously every community has potentials to barriers to recruitment. No community is perfect, so we certainly go through with those. Lack of a team-based approach is certainly something that we see a lot. Basically, in a large urban center, you might have a whole recruitment, you might have 4 or 5 dedicated recruiters, right? Where in a rural organization, you have one person that's maybe doing HR, recruiting, marketing, all sorts of things. So we really need to have that process in place. And just a few other ones to highlight here. We talked about marketing tools, shortage of candidates. We know that we're already starting off with a smaller pool in rural areas, so we have to be even more effective than our urban counterparts. Perception of community, I mentioned earlier, overcoming that feeling that rural is isolated or doesn't provide as good care as our urban counterparts. And then certainly housing has become a very large issue as well. Next slide. And then finally, we help them identify some sample recommendations. So again, we kind of have that informal conversation with them. We go through their web presence. We try to help them identify unique selling points, talk about barriers, and then ultimately lead them with some sample recommendations and connect them to people within their state that can help them with those recommendations. So again, I would encourage you, for the sake of today's call, to go through those documents that we shared with you guys. These certainly, we kind of came up with this recruitment for retention process, but it's certainly something that can be implemented at the community level as well. There's nothing in here that is, national secrets or anything. I think if you can share some of those documents with your organizations, kind of nudge them in the right direction. It's really about identifying, what makes their community special, what makes them unique, and how do they know those things? They can ask the people that already choose to live and work there, and then communicating that out. Next slide. So with that, I will turn it over for 2 practical examples of some of how these resources have been implemented over to Mandy.
Thanks, Mark. Again, my name's Mandy Chingris. I'm Director of Education with 3RNet, and I wanted to just take a couple minutes to share with you some of our examples that we have done with a couple of different states. First of all, we worked on a project with South Carolina Office of Rural Health. We worked with them on a behavioral health workforce collaborative. It started out earlier this year. We did a 3-part webinar series that was focused on different strategies to recruit behavioral health professionals. And also ways to create a positive culture for retention. And after we did that 3-part webinar series, we moved on to virtual assessments, and the South Carolina Office of Rural Health selected 3 SUD treatment facilities to participate in that first round of virtual assessments that we completed. And I'll share a little bit more information on the next slide. And as part of the 3rd part of that behavioral health project, we did, they're participating in our 2023 Academy for all of the behavioral health and safety net facilities across South Carolina. And then in Louisiana, the Louisiana Rural Health Association, we've done a 4-part project, workforce project with them on recruitment for retention readiness. And it started out with a 3-hour in-person workshop presentation at their annual conference in Louisiana. And that was the session there was a focus on attracting and finding candidates. So it talked about sourcing candidates, marketing to candidates, and then retention best practices as well. And then we're currently in the process of doing virtual assessments with 9 of their selected rural facilities. They had an application process, and they selected 3 rural health clinics, 3 critical access hospitals, and 3 federally qualified health centers to participate in the virtual assessments that Mark has kind of walked you through how we do that. And that is still ongoing. We plan to wrap that up by the end of the year. They're also participating in the Academy statewide. And in December, we're going to be having a wrap-up webinar on all of the findings that we found from the virtual assessments. So all of their facilities are going to be invited to that, and we'll kind of go through all of the lessons learned and things that just the overall findings from all of those assessments. And Nick, you can move to the next slide, if you will. This is just an example of some of the marketing projects that we do to promote the programs. This is a sample of the South Carolina Office of Rural Health, their readiness assessment flyer. Christine Morin does all of our marketing. She does a great job of creating some really great visuals that the states can then use to promote the project within their states. So she puts together these digital flyers. Louisiana was really unique. They ended up creating a website page to kind of show all of the different pieces of the project that we did in Louisiana. And I have a link there if anyone was interested in checking out their website page. But we helped her with some of the graphics for that website page. We also have state-specific access codes and registration links so that everyone can access the webinars. We also have scheduling links to make it really easy for each of the facilities to schedule the interviews for the assessments. And then also we provide an hour-long presentation for all of when we're giving all of the overview of all of our findings for the assessments. So that's all done with the really easy to use Calendly scheduling links. It makes it just really seamless for everyone. All of our webinar sessions were all recorded so that there was on-demand viewing. That goes for the Academy and also the behavioral health sessions that I did in South Carolina as well. And like I said, we have the wrap-up webinars that gives all of the statewide findings on the assessments that we do in the states, which is really well received. And overall, I would have to say that some of the best takeaways, actually, if you want to move to the next slide, Nick. Some of the best takeaways that I hear from the the individual assessments that we do are all of the great resources that we provide. We really are providing, like Mark had said, it's one-on-one individual consultation services. You know, we're helping them realize all of their best selling points about their, not only their opportunities, but their organizations and their communities. And then we are showing them ways to market that to candidates. So we're talking to them about what candidates are looking for, and we provide sourcing strategies for them. We give them a sample sourcing plan. This is just a list of some of the resource guides. And these are all available in that link that Mark had shared as well on the Academy link that Mark had shared. But this is just a snapshot of some of the additional follow-up resources that we provide during the assessment overview to each of the individual facilities. And I really enjoy doing them because it just gives us individual time to work with the individual facilities to really drill into what they're doing really well and identifying some things that they might be missing and, you know, didn't maybe realize. So I always get a lot of really great feedback from everyone about how much they really value all of the resources and the information that we give to them. It's really appreciated. And I think that might be it. If you want to just advance, yep, there's our contact information.
Fantastic.
Yeah, thank you very much. I just want to kind of finish up, Nick, with a comment. I really appreciate Mark and Mandy's work on these. They have done the bulk, well, almost basically all of our assessments here at 3RNet over the last few years. So definitely appreciate everything they've did to help grow this program. And we'll be available to answer questions here. I don't know where you are on your agenda, if you want to come back to questions later, or if you want to take any questions now.
Yes, sir. We actually, we can certainly come back and use a chat too. I want to just foot stomp the fact that, you know, 3RNet, it's incredible, all the services that you all offer, and literally every rural health system out there, all the critical access hospitals are trying to develop strategy to help them not only with recruitment and retention, but also to be competitive in the space. So many of the services that you're offering not only inherently help build their capacity in terms of recruiting and retaining highly qualified staff, but also they're still simultaneously in the process of trying to build their marketing strategy for their service offerings. They're doing what they can to be in compliance with No Surprises Act and price transparency. So they're undergoing website and brand refreshers, and they're trying to really engage the community to build their brand. To stop out-migration. So literally it can't be understated how valuable the services 3RNet is. So thank you, Mark, for dropping the points of contact in the chat there. For any state flex programs that are not fully leveraging, or the cause you don't feel like that, you feel like there's a margin there where they could really optimize utilization of 3RNet, or at least awareness of it. Strongly encourage you to pursue that and developing those capacity in regards to partnering with them. So let's see, we've got several. Looks like Chris has got a question. How many states on the call think facility might be able to benefit from some kind of workforce readiness assessment? I would argue all of them, Chris, but I'm a little biased here. Let's see, we got Washington. They need one. I mean, and to foot stomp the fact that the academy alone, statewide, you know, how many we've got calls from what, close to 80 to half dozen or so. I mean, that's huge just for a minimal fee to coach them up on, you know, best practice and really have full immersion with many of the things we discussed here. I do want to ensure that we are allocating time for our next guest, but absolutely thank you, Mike, Mark, and Mandy, so much for your time, and certainly if we got time at the end, we'll catch some more questions here. We greatly appreciate you sharing this with us today.
Thanks, Nick. Mandy and I will be around for it. Okay, thanks.
Excellent. Thanks, sir. All right, let's see here. And without further ado, like to welcome Our guest speakers today, we've got Laura Brooks from Oklahoma Flex and Roger Neck from Fairview Regional Medical Center. They are exceptional best practice recognition award winners for their creation of a workforce pipeline from CNA to LPN. And we talk about creating pipelines all the time, but how it's done and actually implemented. We're excited to hear the steps it took to get there and also the outcomes of that. So thank you all so much.
Nick, this is Roger. Do you have my slides?
Yes, sir. Yes, sir. Let's see.
Okay, thank you.
I'm pulling them up for you right now.
And for those that haven't seen 3RNet lately, you haven't seen 3RNet because I've really been impressed with what has changed. So thank you.
Excellent. Can you see that, Roger?
I can, yes, sir. Go ahead, advance to the next slide.
Okay.
Fairview Regional Medical Center is a critical access hospital located in Northwest Oklahoma, right about where you see the star. When you mention you're in Northwest Oklahoma, everybody automatically says, oh, you're in the Panhandle. But no, we are not in the Panhandle. We are in the section of Northwest Oklahoma. Next slide, please. This is off of our community health needs assessment, and it shows our primary service area of a population of about 7,675, secondary service area of about 7,570. A total service area that we serve is closer to about 12,000 population. As you can see, there are other hospitals scattered around, but it is a little bit of a isolated area in Northwest Oklahoma. Next slide, please. Workforce development has been critical for rural hospitals for years, really been compounded by COVID. What we started looking at is what can we do to get nurses? We can throw another $2 an hour at them, and you'll get a nurse until your neighbors throw another $1.50 an hour at them. So it winds up being a rotational force. What we found when we worked with our local tech center was that the straight out of high school student doesn't quite have the maturity to invest what it takes emotionally and physically to move from a student to being a nursing student. And then they wind up with families, so they can't afford to make that transition to get back and complete their education. What we started looking at is our certified nursing assistants that are just really a good, solid employee that demonstrates the skills and the ability to learn. And we offer to stipend them 30 hours per pay period while they're in school. They work one weekend a month to keep their skills up and to keep their contact with the workforce. We've been blessed to have a hospital foundation that was started by a couple of retired nurses that left their money to make sure that there's education continuing. So the hospital foundation provides the tuition assistance. We stipend the nurse while they're in school, or the CNA while they're in school. And upon completion of their LPN, they sign an agreement to work for us for 2 more years. So with that, we graduated both Angelina and Jaslyn from a certified nursing assistant to an LPN, and have them now working in our workforce. Next slide, please. One of the hardest things to find in a rural area is somebody that is really good in the IT world. This is Zach represents our second student. It's really kind of a kick to watch a 16-year-old Zach with an approaching 60-year-old Bob get together and have a conversation that is really on a peer-to-peer basis that you wouldn't expect anywhere else. Zach's our second student. Our first student went through 2 years with us. By the time he completed, he wired a complete backbone for an addition building, set up the whole network, went from just learning how to run a screwdriver to being able to do a network. It's very hard to get a job in IT without experience, even if you've got a degree. This gives those students the opportunity to get that experience, with the hope they also get a healthcare focused IT experience to keep that pipeline going. So we're looking forward to see what happens with Zach's next career move, as he's just starting with us now as a junior. Next slide, please. Medical laboratory technicians have been very difficult to recruit in our rural area. Prior to the last couple of years, we were able to utilize the J-1 visa program, and we brought 2 lab technicians from the Philippines to join our team. Both were excellent. One's still with us. One moved on to a larger facility. But the pipeline for J-1 visas has been pretty well shut down as post-COVID, their backlog, not being able to work through anything. So what we've done as an alternative is CC on the left came to us with some college, but as a phlebotomist. Shivani on the right came to us with a degree in chemistry, but not really much you can do with a degree in chemistry. We partner with a college, community college out of Kansas, and we do the on-the-job training. They do the remote classroom, and that gets them able to sit for their certification exam as either a laboratory technologist or a medical laboratory technician. We had one prior student that came to us with a degree in chemistry and biology, became a medical laboratory technologist, and is now a second-year med student at University of Oklahoma School of Medicine. So we're hoping that pipeline brings him back to us in about another 5 years. Next slide, please. We were very lucky. I say lucky. There was a lot of hard work to being able to achieve an Economic Development Administration grant to build a new outpatient 5,200 square foot outpatient physical therapy building. But using that building, next slide, we're able to bring a lot of resources back into our small community that was leaving our small community. It used to be our student athletes all were rehabbed in a sports rehab center. It used to be that we were looked at as just, the old folks rehab, the stroke rehab, the post-hip replacement rehab. But we've now been able to expand that. Next slide, please. Everybody tells you that your best and brightest leave home and never come back. But with this new rehab center and keeping tabs, as a small community, you get to know everybody that graduates high school. Keeping tab on those students, even after they've graduated, and reaching out with a cold call has been successful. Madison on the far right graduated from our high school, has certification in athletic and sports medicine rehab. She was practicing in Tulsa. We were able to bring her back home and her husband and their family. Baylor on the far left also has certifications now in Parkinson's, graduated from our local high school. We're able to bring her back from Oklahoma City. Hannah right next to her graduated from a neighboring high school in the small town of Waynoka. She's certified as a pelvic floor therapist and brought her back also from Oklahoma City. Hannah in the center is an occupational therapist, graduated from a small community high school near us of Ringwood. Cold called her and were able to get her away from a large rehab center. And they were able to then each bring a different skill set that's been able to keep a lot of our people back home, as well as bringing these 4 doctorate level trained young people back to our community. And by bringing them to our community, we also brought in Emily to be our office coordinator, hired another housekeeping and maintenance staff. So it brought 3 more jobs to our community. So I keep saying healthcare is an infrastructure. It also helps to create a workforce within your community. And I believe that's all I have. Thank you.
Outstanding, Mr. Mack. That's just, we talk about recruitment and retention and how important it is to build out these pipelines, starting from the, some even argue from the middle school level, but junior colleges, high schools, and really identifying the workforce you'll need not only now, but in the future. But there's a fine line between being able to recruit them and being able to retain them. And it looks like you've done exceptionally well to be able to build a kind of culture that keeps them there and makes them want to come back to your organization. So certainly we'd love to see cause across the country continue to look at it through those lenses. And we have another exceptional speaker. Thank you so much, Roger. If you will entertain questions here at the end, that would be fantastic. We appreciate your efforts. And we have Miss Danita Grossberg on the line from Clark Valley Hospital. And let me stop sharing here. All right. Okay, so Montana Flex was also recognized by best practice recognition with Clark Valley Hospital for the exceptional work they've done around employee recognition. So we talk about this, how can we actually retain quality people once we have them? Danita, I'll let you take it away because it appears you've solved that puzzle.
I did. Yes, can you hear me okay?
You sound good, thank you.
Okay. Roger, you're a hard act to follow for sure. That's very, very impressive. I was very surprised to get this nomination, seeing how I didn't submit anything. So I can thank my colleagues for that. So I'm rather humbled to have this opportunity to speak about what I've done here at Clark Valley Hospital. We are a rural access hospital in Plains, Montana. There's our facility there. So I will try to be very quick about some of the things that I've done here to retain employees within my facility. When I first started this program, we were about at 23% turnover rate. It was pretty bad. I'm currently sitting about 8-9%, so it's made a significant difference. That's not to say that people these days, especially young individuals, they just don't stay in one place for all too long. But I think all in all, it has definitely helped some of the things that the challenges we're facing in healthcare with retention and keeping people in one spot. I think this is a very funny little cartoon because I think we're all very guilty of trying to do this, where we just throw up the blank thank you in the break room and hope that it's going to reach all of our people. Not that any thank you is bad, but I'm hoping that I can give you some tools that I've used that take it a little bit farther and more impactful to your people than the break room thank yous. Employee recognition, the act of acknowledging your people for who they are and what they do, right? Employees who feel appreciated are more likely to personalize care and engage in consistent behaviors that accelerate organizational excellence. Basically, they're not going to buy into what you're asking them to do if they're not happy with their job. This is one tool that I use. I give this to all employees when I hire them. It's a tool that allows me to get to know them right off the bat. It first acknowledges, you'll see if they like to be acknowledged for holidays. It helps me to know and show them respect that if they don't want to be acknowledged for holidays, because I do put a lot of work into holidays, then I know that those individuals who do not appreciate holidays, I have to figure out other ways in which to acknowledge them and celebrate them. It also helps me to get permission if I can celebrate their birthday. And it, instead of just assuming that I can, I'm asking their permission. Not everyone appreciates their birthday, right? And so this grants me that permission. It also goes through and tells me how they like to be celebrated, how they like to be recognized. Not everyone likes to be recognized the same. This is pretty horrific for me today. So I prefer to be in the background, to be honest. And so this is I don't prefer to be out in the spotlight. So it just depends on how you like to be recognized. And this helps to identify how you like to be recognized. It also helps to tell me what kind of treats do they like. I guarantee if I get a root beer on my desk with a thank you note, like that means so much more to me than a blanket something else. I know that my manager has customized something, especially for me. So it makes a difference. It's just little, but it makes a difference. Thank you cards. We always talk about thank you cards. They seem like a really easy, generic way to thank our people. And depending on the size of your staff, you should be sending out thank you cards often. I have 40 people on my staff, so I can't send out monthly thank you cards. So I tailor it down to Nurses Week and Thanksgiving. Those are the 2 times that I make sure I handwrite a personal thank you. I talk about them individually and I mail it to their home. And it makes a big impact when you mail it to their home versus setting them all in the break room again, right? Their husband sees them open it. Their family sees them open it. Often I thank their family for the sacrifice that they give to our facility because I ask a lot of them and they are away from their family a lot. So it makes a difference, those thank you cards do, especially when you mail them to their home. Birthdays are a really easy one. It's a really easy way to celebrate people. Every month I put up the birthday sign of the new people for that month who are being celebrated. I also, at the beginning of the year, I write out birthday cards for the entire year of all 40 of my people. And I, at the beginning of the month, then I could just pull those. I put the $25 gift certificate in there and I pop it in the mail. It means a lot more to get something substantial. $25 gift certificate means something versus just a happy birthday. They feel appreciated, they feel special, that you recognize them. For those people who don't want to be recognized for their birthday, I use their anniversary date, the date that I hired them. And I send them on that date a thank you for being part of the team. Really appreciate you. And it makes a huge impact. They appreciate that. I do things like I always have a candy jar on my desk. It's always full and my people go on strike when it goes empty. So it's something little, but they definitely appreciate it. Christmas, I always give them something nice. These were the jackets I got for them last year, tailored to their size. It shows that it's not something blanket, right? It's a tailored gift for them specifically, and it makes a difference. They appreciate it. Easy one, employee of the month. This is a super easy one to do, and it makes a big difference. I put out an email, peers nominate each other, and then I post that nomination on our kudos board for the entire month so everyone can see it. And if you get nominated, you also get a treat. If you get chosen, you get the pin and you get a $25 gift certificate when you're chosen, and then you obviously get your name posted up on the board for that time. And those people are definitely leaders amongst the team, and it's an honor to be chosen because you're chosen by your peers. And there's no better recognition than that. So it's an easy way to recognize people and make people feel important. Pizza appreciation. This is something I do quarterly. This is a form that I put out. I posted at the nurses station with specific shifts because we work in shifts, the front of the week, the back of the week, day shift, night shift. So I put their names at the top specific to that team. They then can put what kind of pizza, what kind of breadsticks, they tailor it to themselves. At the bottom, I then say your pizza will be delivered Tuesday night at 7:30. And then I order it and I deliver it to them. And it takes effort, right? Like that takes effort. I have to schlep in my pajamas away from my family and with the pizzas in tow and bring that in, but it makes a significant impact on that team, especially night shifters. They always feel left out. So it makes a big difference to them. And the fact that they can choose what they want instead of just giving them cheese pizza, it makes a huge impact for them. Here's my kudos board. This is something that I created, and then I have little cards that I created that I put everybody's name on. This is employee driven, so employees kudos each other constantly. You can see that they either write on the board or they send me an email kudosing each other, and then I put their name up there with a little treat, and it gets quite full at times. It's an easy way, and it really, once it gets going, it's everyone's doing it to each other, and it's just great recognition and great morale boosting. And it's very large. It's floor to ceiling, that board is. Logs, I definitely believe in logs because I'm super organized, but thank you logs. Like this helps very much to make sure that I'm not leaving out those individuals that are the silent ones who just come and do a great job, and they, you know, you never hear about them, you never hear them fuss. They just always come, they do good, and sometimes you can easily forget them. So this helps with recognizing, oh my goodness, I haven't recognized Daniel in 2 months. I need to make sure that I give him some kind of kudos or something just to tell him that I appreciate him. It also identifies your low performers. Like, holy cow, I have someone who hasn't got a kudos for 6 months. Why is that? Well, we probably need to have conversations about what's going on there. It helps to identify those low performers and helps me to keep on track of making sure I'm addressing those issues. More logs. So birthday logs, as I send things out, I check them off to make sure that I don't forget and forget to send things out. Evaluations, again, I think it's very important and it shows respect when we do employee evaluations on time. When we forget, they think we don't care because it doesn't matter. They don't matter, and they feel disrespected. So staying on top of employee evaluations is super important, and to be prompt with them shows respect and shows that you care about them, and trying to stay on top of them is super important. So logs are super helpful for myself. This is something that I created in the COVID days when we had a lot of grief and strife amongst our staff. It's an Orange Heart support program. I had to shrink this down. It's much bigger, but it basically gives the staff a tool to identify anyone who's gone through something that they might need some extra support, whether it's something at home or whether it's something here. If we've had pediatric codes, we see a lot of trauma in our facility. Things that shake you at times, or you're going through a divorce or whatever it might be. This notifies me so that I'm aware that something's going on, and I can get our social worker and our counselors involved. We can send them flowers, condolences, cards that the staff has all signed. We start meal trains, whatever it is that person needs without them having to let us know that they're struggling. Because when you're struggling, you usually don't ask for help. So it's just our silent way of helping them. Sometimes it's a money pool, gas pool. It just depends on what their need is. These are all the things that our hospital does, and they are great. They add to my recognition program. I just want to emphasize they should not be your recognition program. The things that your hospital does should support your program, but they shouldn't be your program. I'm going to skip through that because that's just a silly little thing. This is my last slide, and hopefully I'm not going over my time. Just flag me, Nick, if I am. I think first and foremost, onboarding, orientation, and mentorship. Really, recognition starts at day one, and making sure that you have a good orientation program, a good onboarding program, a good mentorship program for especially new graduates, so that they can learn and train and feel like they're empowered to become a leader and become a good nurse is really important from day one. And that spreads like wildfire, especially if you're recruiting through schools. They hear about those experiences of those new graduates, and they talk and they chatter, and that really helps bring in more new graduates. Rounding is something that I do quarterly, and rounding is a term that we use here. That's when you sit down one-on-one and meet with every single employee. It's that 15 minutes. It only takes 15 minutes just to sit down and talk about the schedule. Is it working for you? Are things okay? It's just a check-in, really, for you to grant them that time, one-on-one, non-interrupted time to check in and make sure everything is going well and see if they need anything. And they look forward to that time. They know they can have that time to visit with you. And it definitely wards off resignations that occur that you're not prepared for. Really, I feel like I shouldn't have a resignation coming that knocks me off my feet that I didn't see coming. I should know my people well enough to know they're struggling, or they're looking elsewhere, or they're whatever it might be, so that when I get their resignation, I can say, yeah, I saw that coming. Yeah, makes sense. Importance of individual schedules. I try very, very hard to work everyone the schedule they want. As we know, we're 24/7, so that's really hard. But I really try to work people the schedules that they want, because that's what keeps them here. Their schedule dictates their life, and they're going to leave if it's bad. So time off requests and mental health days, I never deny a time off request. I make it work. And if that means that I have to come in and work that time, then I do that, because it's very important that they know they can go to their wedding this summer or whatever it might be. Very important. Clinical recognition, celebrating, if someone's training to a charge nurse and they've completed that, celebrating that amongst the team so that they get those accolades from their peers and everyone that they've succeeded. They've trained to the ER, or they've trained to those different things. And I mentioned before, celebrating anniversaries every year, like 1 year, 2 year, 3 year. Just putting it out, hey, everyone, just kudos to Jenny. She's celebrating her 2-year anniversary with us. Thank her for her dedication to our team. That means a lot. They appreciate those things. Training, lots of training. People want to feel like you're investing in them. When you send them off to some training in another little town or even the bigger cities, they feel like you care about them. You care about their professional growth, and you are going to let them go do something fun and learn at the same time. It means a lot to them and gets them away from here and lets them do something fun and advance their skills at the same time. So I try to do as much of that as I possibly can. And it's hard because we're rural and the schedule only allows so much, but I'm definitely trying is the point. Promoting accountability across the board and being real, right? Like it's very important to be real with your staff and to be able to be vulnerable with them. If I make a bad decision and it didn't go well, to be able to stand in front of them at a staff meeting and say, you guys, that was a really bad decision. That did not go well. I'm so sorry that you guys had to endure that. Let's start over. And when they see that humility, they're more apt to be vulnerable themselves and know that you're a real person and that you make mistakes too. So when they make a mistake, they'll come to you and talk to you about it. And they feel more secure working for somebody who's real versus somebody who's not. So in a nutshell, those are kind of some of the things that I do here at Clark-Brook Valley. Hopefully I didn't go over my time. I tried to
You're great. Lydia, that was fantastic. And I could not agree with you more on your be real kind of approach to this. We talk about, trust and having, a just culture where it's okay if we make mistakes, it's all right. Let's talk through them so we can avoid a EMTALA or whatever other violation is taking place. But that and being genuine with all the things, obviously you all are exceptional in that. Do you have any advice for our flex coordinators to pass along to critical access hospitals about how if they're working to develop this really a robust recruitment and retention strategy, is it best to have formulate a committee that spearheads this effort? I would assume that champions such as yourself are really a core component to having a program like this. But any advice on how critical access hospitals could kind of build this capacity with the limited bandwidth they do have for administrative kind of functions?
Yeah, yeah, it is very difficult because we all know we wear so many hats. And I would say just start with one thing, implement one thing at a time, and let that get rolling, and then implement something else. And before you know it, you'll have them all implemented and your program will be up and running. It kind of gets that flywheel approach. Once it gets momentum, it just keeps going. But getting it off the ground is the difficult part. But just start with one thing, and initially it feels awkward because your people aren't used to it and you're not used to it, so you feel a little awkward in it. But once you get used to it and they get used to it, then it's just normal and they appreciate it.
Excellent point. And that it's contagious. Positivity is absolutely contagious, which is why the star employee kudos board, thank you log, and all of that stuff is really transformative to culture. So thank you so much, Danita, for sharing this story with us today. We got just a few more slides here. I'm going to share. Here we go, and then we'll wrap today's webinar up. And feel free to use the chat if anybody's got additional questions for Danita. What happens if Danita isn't here? That's why I was like, I know we got a champion, but as committee's the best approach. Or excellent question, Caleb. Hopefully there's a team effort initiative for that. That only helps everyone to build a happier place to work. And that goes along the lines of this intrinsic versus extrinsic. We've only got a certain amount of line item budget we can afford for our employees. So how can we create a culture that the value added to really set us apart as an organization? So I did want to share this with hot off the press. We have a sustainability toolkit that's actually refreshed from a previous Flex resource we had that was this week. It's been made available. I'm gonna make sure I drop that in a chat here for you all. That's actually one of several resources we hope that you all will please utilize and encourage your cost to do as well. This is great. It's actually it walks through these 5 components here and will assist your critical access hospitals in strategically planning around best practice associated with it. So fantastic resource there for you all. We've got, it's one thing to have, and this goes back to what Danita's point about being real. Okay, we can solicit feedback and employee assessments through 3RNet or a plethora of other surveys and assessments out there. But people really want to know, is it actionable? What are you doing as a hospital leadership to really address those things and to better the culture and create a really exceptional organization? So some of the different types of assessments we've come across here at the center that are very impactful and helpful to you. There's the next few slides here, and then we'll wrap up with our polling. So Forte is one of them, and that it shows the communication styles and what they're adapting. You have teams that executive teams or service line department management staff teams that maybe you're having to adjust and accommodate, and it, their natural tendencies versus what's actually happening really helps to tell that story. So you can evolve your strategy of the hospital to really help them to address the not only pain points, but leverage the strengths there within the teams. That's one that we've had a lot of success with here. The strengths deployment inventory or STI assessment, it's excellent as well. This has to do with motivators within teams. So all teams, whether individuals may be performance driven or people oriented or process oriented, helping them be able to work together to more effectively and cross-functional settings. This has been very helpful as well for the health systems that have used it. And of course, Luma Sparks is also one that's very well known. We've got a handful of others. Everybody, Myers-Briggs, and I think the DHSS uses Pulse as one of the other assessments. Of course, absolutely 3R nets. Anyway, you slice it. If that's the initiatives you undertake within your work plan, please do ensure that you have are aiming at implementation, and the outcomes of that is part of your plan for that funding. We've got sustainability guide and toolkit, several other resources we'll share post-call. And before we conclude with the polling, I wanted to check with Laura to see if there's any advice regarding work plan funding.
I do. Can you stop sharing your screen and can I share mine
Yes,
super
ma'am.
quick?
Stopping right now.
Yep. I am going to start by saying a major thank you first off to both Roger and Danita for sharing your experiences and the work that you're doing at the hospitals. I think it is so impactful for us to hear directly from the hospitals and what you need, what you've worked, what has worked for you and what hasn't. And so other states can learn from you. So thank you again for doing that. This is just a very brief, I'm going to kick it to Sarah super quick. You're probably wondering, well, SOAR covers workforce, so why are we having this conversation about flex, right? So we're going to kind of talk a little bit about how these may be able to work together very briefly. Sarah, you want to tell us real quick about SOAR? You're gonna.
Hi, everyone. This is Sarah Njengui with the State Offices of Rural Health Program. And as you can see, there are opportunities where the SOAR and FLEX programs can work together with outcomes within our programs. Our program goals to collection and dissemination of information, coordinating activities, and providing technical assistance to stakeholders. So as you can see on the slide, through the SOAR program, you could pay for your 3R NEC membership. And these are examples of things you can do. You can pay for trainings, provide resources and dissemination of information to your rural partners and stakeholders. And we also ask, and Laura provided the link at the bottom of the slide. We also ask that when in doubt of what activities are allowable under SOAR program or FLEX program, please reach out to your project officer. And we have the map linked at the bottom of the slide if you're unsure of who to reach out to. Feel free to also reach out to me as a program coordinator for the SOAR program if you have any questions. Laura?
Thank you so much, Sarah. Can you mute now? Okay. Sorry, Sarah and I are in the same conference room, so we're echoing a little bit. I know we're right at time. I'll talk really quick. So one important reminder I put at the bottom of this slide is that we cannot duplicate funding. So whenever we get a lot of questions a lot of times, and this is why I wanted to bring this up now, of this is a hypothetical example. I know SOAR normally covers a 3R Net Academy payment, but I have my SOAR money allocated somewhere else. Can Flex pick that up? And that answer would be no, because that would be duplicating what SOAR can do. However, we can kind of complement the two, right? So that really cool needs assessment that 3R Net talked about earlier, you can use your flex funding to pay for that assessment and hopefully do some kind of work to address whatever needs are found in that assessment, right? Because we obviously are trying to move our program towards outcomes. You all know that we do a lot of trainings, we can do certifications with the caveat, they are some certifications. This is another question we get a lot, so I want to take a quick second to talk about it. Please call your project officer if you're trying to offer some trainings and certifications to any of your hospital staff. It needs to fit into your work plan somewhere. So the example I'll give you is that if you are saying that you want to provide a certification for your nurses to become a certified diabetes educator, but you are not doing any work in your work plan from Flex on like reducing diabetes rates in your communities, that's not going to really work because they don't tie together. Right. So as everybody mentioned, there's a ton of resources from TA and TA available from TASC, from NoSOAR, from 3R Net. We know workforce is a huge thing. So just please reach out to us and call us and we can kind of work on figuring out what works best in your work plan between SOAR and Flex and getting ready in your next program year. So thank you so much.
Excellent. Thank you so much for making that clarification known between the two. Laura, and thank you all so much again for your speakers today and for everyone to complete their polling. We greatly appreciate you. Please keep up the exceptional work and we'll look forward to working with you again here soon.
Thanks, guys. Have a good day. Thanks, everybody. Mike, Roger, Danita, the rest of the 3R Net team, as well as Laura. Thanks, Nick.
Have a great afternoon, everyone. Thanks.